Home Health Gold provides access to patients' visit history while they are still active in care. This feature, unique to Home Health Gold, enables you to review episodes to ensure they are progressing as planned and gives you actionable data. The reporting is easy to use, so let's get started. Active episodes can be viewed in different ways, but an effective strategy is to routinely monitor in 3 stages. Beginning during weeks 1 through 2, you can make sure the front-loading of visits is actually taking place and that therapy intended to stabilize frail patients and teach them how to remain independent is being accomplished. You are also in time to make changes to the M2200 therapy need question on the patient's assessment if their condition warrants it. So, click on the cumulative number 89. You will be given the opportunity to choose how you will view this report. Starting at the top, Isabel's care looks good. She has already had 1 PT and 2 nursing visits. However, it would be worth checking with the assessing clinician to understand why there's no therapy originally planned. Isabel's HERG score was C2F2, indicating functional deficits that could and needed to be improved. Louise also appears to be progressing as per plan. Her case is a recert for a B12 injection with a low functional score. Justin, however, warrants investigation. His plan of care calls for 12 therapy visits, yet nearly a quarter of the way into his care, he has only received 1. It would be wise to find out why utilization of services is so low, not only to provide Justin with best practice level services, but to avoid a LUPA. Joshua's plan of care also raises questions. His HERG score is C2F3, but he has no planned therapy. This discrepancy may have been explained at start of care, but if not, review and potentially correct his plan now, in time for him to get help to stabilize and improve his condition. Sandy is another example of successful front-loading. Therapy, both OT and PT, and nursing have gotten involved early. Since it's early in the episode and already 71.6% of revenue has been used, it's time to ask if non-therapy visits can be safely reduced. Have we met Sandy's most acute needs? Lastly, James' care to date, or lack of it, raises questions. 1/4 of the way through his research, he has not received any visits. Why? Are there visits planned for the next week? Can you get them in? Otherwise, in addition to potentially failing to meet the patient's needs, you're also setting the agency up for a LUPA and attracting reviewers with concerns about the need for skilled care at all. The second stage includes those patients receiving care in their 3rd through 6th week, the midpoint. Here, managers can keep their eyes on utilization of services, check to see if revenue available is dwindling, and whether it is safe to decrease visits. During this stage, there should not be LUPAs if visits are being front-loaded. The first 2 patients' care seems to be progressing as planned. Notably, Roxanne had 3 OT and 1 PT visits to help her learn how to be independent and safe in her home. Her episode is almost 1/3 of the way completed, and she has received 1/3 of her therapy visits. It may be time to consider reducing any non-therapy visits to keep episode costs in line. Janice entered an inpatient facility 2 days into her care by the agency. Looking at the visits completed during that time, 6 nursing and 2 PT, it seems as if front-loading was occurring. You will want to monitor Janice's case to know why she was transferred, if she will return to your care, and if she does not, investigate why not. Was she displeased? Did the hospital refer her elsewhere? In Eileen's case, it is worth determining why, only halfway through her episode of care, 117.6% of revenue has been used. Why did she need so many nursing visits? Could an OT get in quickly to potentially teach her ways she might help herself in the future? What is the discharge plan? If we look at Teresa, we see she was transferred after only 1 day in care. It is important to understand why. Was she prematurely discharged from the hospital? It is curious that her HERG score is C3F3, documenting significant clinical and functional care needs, yet she was not scheduled to receive any therapy services. Is she coming back into care? If she is, what is the new plan? If not, why not? The third stage to review includes those episodes within their 7th through 9th weeks. Looking over these patients lets you know whose needs are being met and whose are not. Now is the time to discuss possible discharge plans. If discharge is not going to be an option, is the patient appropriate for research? Are they still homebound? Jose was transferred to a hospital about 4 weeks into care. During that time, he didn't receive any of his planned therapy visits. Why not? If your agency monitored active episodes in stages, you would already have been alerted to Jose's missing therapy visits, possibly in time to make sure they were delivered and to keep him out of the hospital. In any case, it is worth finding out why the visits did not happen early in Jose's care. Were there staffing issues? Were there other factors? Catherine has also been transferred. Again, the question to ask is why? Will she be coming back into care? Could we have handled her case differently? Anne seems to be progressing well. Is her discharge planned? Claire's costs have overrun her planned payments. It is good to find out why. She has had 8 home health aide visits, which are costly to the agency, but no OT. Could OT get in quickly to train the patient in ways to help herself to be safely independent? This case is already a therapy upgrade, so why not involve OT now, if appropriate, and make sure need is well documented. Looking at Raymond's care, we again see heavy use of home health aides with no OT involvement. That could explain why 86% of the way through the episode, revenue expenditure is at 110% plus. Could OT become involved now? Why weren't they planned originally? What is the discharge plan? Has he been helped? Madeline appears to be doing well. Is there a plan for her discharge? There are other ways to approach this wealth of active episode data. You can zone in on the utilization of all services combined or pinpoint a specific discipline. For instance, OT visits during weeks 1 through 3 to see where OT is being used. Or check PT visits from week 1 through 5 to study use of these specialists during the weeks when patients are generally at their greatest risk for falls and injuries. In any of these reviews, you can choose the time frames, disciplines, and the number of visits you want to study. You can customize the search to get at specific information your agency needs in order to make smart, data-driven decisions. It is also extremely easy to look into situations agencies commonly want to monitor. Again, if you consistently review episodes in progress at the 3 stages of completion, you will catch these occurrences as they happen. But if you are targeting particular situations, like 5 or more home health aide visits with no OT involvement, it is easy to go directly to the listing on the bottom section of the Episodes in Progress Date Choice page and click on these frequently searched for flags. You then instantly have the patient and their detailed visit information at your fingertips. It's easy. Now try for yourself.